quite an excellent tool, but a bit daunting. So, what you're seeing here, what you're going to learn about from New York is how to do something daunting and the rewards of doing that. And there's a lot of knowledge presented in this presentation, but when I woke up this morning, I thought about um, beyond knowledge, when a group of people endeavors in something like that, there's this enormous collective wisdom. And New York has got it. And so they're going to share some of that with you. The other thing I want to say is, these just aren't what happens when you do planning together is very relationship based, just like respite itself. And I just was thinking about the qualities of this team of people from New York this morning, and I wrote down the words, they're curious. They're curious about each other. They're curious about caregivers. They're curious about community. They're very collegial. They're generous. Any of those who have attended the national conference in New York know this. They're very loyal and committed to each other and to their communities. And I have to say, they're serious about the work, but they're joyful. There's like laughter and joking. And again, we've all been part of that during the conferences that we've attended. So as you listen to what they've accomplished, think about how they've accomplished it. And all these qualities that they bring, I think, have contributed to their success. So with that, um, I'm most of you already know Abbey Dara. I can usually say it Abbey, and I just tripped. Derepentigny, Deana Prest, and Doris Green. And Abby's going to kick us off. And here we go.
Thanks, Susan.
You're
Hi,
welcome.
everyone. As Susan mentioned, I'm Abbey Derepentigny. I work at the New York State Office for the Aging. I am the Caregiver Support Program Coordinator, and I'm joined by my colleagues Deana Prest and Doris Green. Today, we're going to talk about the evolution of sustainability with a focus on planning, measuring, and pivoting. You can go to the next slide. So this is our agenda for today. We're going to start by going through the who, what, when, where, why, and how of sustainability planning. Then we'll talk about how we measure our successes and the challenges that we faced along our sustainability journey and how we've pivoted as a result of those challenges. Next slide. So the goal of our sustainability plan was to connect statewide partners, exchange knowledge and ideas, which would lead to the development of a plan for sustaining the respite care system in New York. We really wanted to look at how we could strengthen community partnerships, maximize the use of existing resources, identify and leverage new respite funds, plan for sustainability, and focus on future development. So we can go to the next slide. And now we're going to talk about why we in New York decided to embark on a sustainability plan. Next slide. So we wanted to develop a clear plan for sustaining the key elements that make the Lifespan Respite Initiative successful. What would we do if we weren't awarded a Lifespan Respite grant? In New York, our coalition does not receive any state funding. So if we were to lose our Lifespan Respite grant, the coalition wouldn't necessarily be able to sustain all of the great work that they do. Another consideration is the environmental factors. We are a very large, diverse state, and the funding from the Lifespan Respite Grant is crucial to ensure that the coalition can reach all regions of our state. We also wanted to be sure we're not missing any opportunities for resources and additional funding. And the sustainability journey that we embarked on, that Doris will talk more about in her slides, really helped us look at all of these key factors to determine the best plan for moving forward. Next slide. And we'll talk about who was involved in our sustainability planning process. Next slide. So the Lifespan Respite core team was all of the people involved in our sustainability planning. So we refer to ourselves as the core team, but it consists of New York State Office for the Aging staff, the New York State Caregiving and Respite Coalition staff, Lifespan of Greater Rochester, which is the organization that hosts NYSERC, New York Connects, which is our Aging and Disability Resource Center, or No Wrong Door in New York State. And previously, we partnered with the Monroe County Office for the Aging. We do still work closely with them, but they're not considered a formal partner on the grant anymore. They were an active partner, but they were essentially a pass-through agency for funding. And it seemed like the process for receiving funds was just a little more difficult having the Office for Aging involved. So now we directly contract from the state office with the coalition. And I have to say, probably our most important partner in the sustainability journey is our project evaluator, Dr. Tom Caprio from the University of Rochester Medical Center. Tom has been the project evaluator since New York received its first grant in 2010. So he is very familiar with the coalition and all the work that's been accomplished over the last 15 years. Tom completes annual evaluation reports for us and provides us with the support and evaluation guidance. And he, like I said, he is an integral part of the core team. Next slide. So we feel that using a project evaluator has been really important to help us with sustainability planning. Having Tom really guide us, takes the pressure off of our team and allows us to think freely and critically. Tom was able to take the Arch toolkit and pare it down to the essentials that we needed. And he really asks the questions, the difficult questions that we need to think about, and helps guide us to where we want to be. Next slide. And as Susan mentioned, we do have a really strong partnership between the State Office for Aging and the Coalition. We really do believe that this is a key part of our success. We feel that we're able to have a working relationship that values respect and even a little fun sometimes too. At the State Office, we always try to highlight the activities of the Coalition, and we really try to work together as much as we can. So we at NYSOFA host monthly caregiver program webinars with our Office for Aging staff, and we allow NYSERC time on those webinars to share any announcements or updates for the programs and activities that they have upcoming. We partnered together on a respite voucher work group with our local Office for Aging staff, which turned into a voucher program for the coalition. And you'll hear a little bit more about that later. And as a result of that work group, we also expanded our caregiver directed respite service delivery to include respite vouchers. We also meet bi-weekly as a team to discuss progress on our grant deliverables and any challenges. We've partnered together to present at conferences or co-host conferences or forums, which we just wrapped up 4 regional caregiver forums in June. And whenever we're asked to present on caregiver services in New York State, we always do try to co-present or share one another's information. Next slide. So now we'll talk about the when and where involved in sustainability planning. So we can go to the next slide. So in 2017, the Lifespan Respite Core team completed a sustainability self-assessment. And based on those results, it was decided to meet in person for our first sustainability retreat. And that was in 2018. And we meet in Rochester. And we've met annually since 2018. We did have to hold one virtual retreat due to COVID, but we have since gotten back to those in-person meetings. And we've also conducted 2 sustainability summits. One was in Albany and one was virtual again because of COVID. And you'll hear more about the retreats and summits from Doris. Next slide. Okay, so what did we do at the retreats and summits that helped us with our sustainability plan? We can go to the next slide. So this is a roadmap that shows what modules of the Arch Sustainability Toolkit that we used at each retreat, what tasks we wanted to accomplish, and the timeline. So we went through the toolkit modules from 2018 to 2021, and then we wrote our sustainability plan. Next slide. We used the sustainability toolkit to guide our retreats, which was developed by the finance project in collaboration with Arch. It contains 5 modules that help lifespan respite grantees clarify their vision, identify key issues in sustaining their work, and develop strategies to achieve long-term goals. The kit is filled with tools, worksheets, and guides. And like I mentioned before, Tom took the toolkit because there was so much information included and really pared it down to what exactly we needed. And you can see here at the first retreat, we had a discussion on what the core team wanted to sustain. And it was clear that the coalition was the most vulnerable piece of the puzzle. So from there, we worked on modules 1 and 2 of the toolkit. We can go to the next slide. And then this slide outlines our objectives for the sustainability retreats, which were to examine the efforts in coalition building through NYSERC, including opportunities for membership and expansion and enhanced engagement, to review the sustainability self-assessment core elements and score the progress indicated in the self-assessment, discuss performance measures to evaluate progress in planning and implementation, develop action steps toward a statewide sustainability plan, identify state-level policy and program needs related to respite care services for children, adults, and an aging population to increase advocacy capacity, strengthen state and community partnerships for advocacy efforts for caregivers across the lifespan, and identify potential challenges to sustainability. And now I'm going to turn it over to Doris.
Thanks, Abby. So next slide, please. So what I'm going to share here is some of the pages that were just stuck to the walls after Dr. Caprio engaged us in discussion. And Abby wasn't at the first retreat, but it really was a fascinating discussion around what to sustain and what does sustainability look like. Because from the state side of the room, there was more discussion on sustaining the entire lifespan respite grant. But after much discussion and thought, it was decided that the coalition truly was the most vulnerable piece of the lifespan respite grant, that the rest of it would probably go on under the State Office for Aging, even if we lost a lifespan respite grant because of the robust caregiver services that existed within that infrastructure. So really that discussion was a huge piece of that, of us coming together. So I just want to read this second goal to you because it's in orange and it's kind of difficult, but we really needed to develop a shared understanding of what to sustain so that we could come up with a shared goal so that we were all working in concert together. So the goal was to build upon prior and current lifespan respite initiatives to increase and expand access to respite services statewide and enhance partnerships for education, outreach, and service provision to enhance development of the lifespan respite program. So it really did then focus on results orientation once we had this shared piece. Next slide, please. So So then during this whole discussion, we really had to look at, my slides are out of order. We had to look at what was lifespan respite from policy, providers, caregivers. How do we bring them all together? So we really looked at the positives, who was involved, what was the other funding, and what were our accomplishments thus far. Next slide. There we go. We looked at lessons learned, which, in this process of what we're showing you, all this nitty gritty, we really look at this every year. Like we review it and we update it so that we are really on top of the things that we need to be on top of. So it's not just respite, it's respite and caregiving. It's all encompassing. And the recognition of the caregiver role and the caregiver's evolving role as they go through the caregiving journey. We looked at gaps in policy and priorities, communication strategies, and this is where we really began to identify who were the stakeholders that we actually were working with right at that time, because as part of the goal that I just read a few minutes ago really is to expand and build upon what we already have. And that has been our mission throughout well, we just finished our 7th sustainability retreat last month. So it has been our process all along, is to build upon the existing things from year to year to year.
It was
Next
actually
slide,
our
please.
8th, Doris.
Was it our 8th? Okay.
Yeah,
I had
I'm
pulled in
gonna
one of
cover it,
them,
but
so
yeah,
I
we
don't
have 8.
remember that one. Okay. Again, we were looking at what are our resources with partnerships, with funding, and what does a sustainable coalition look like? Here's the one that always gets me. Like, we have been talking about the development of membership for a really, really long time. And it's a tough nut to crack. And I don't think that well, somebody might have written a definition recently, but whenever we have different funding sources, they all want to know the size of our membership. How many members do you go? How is it, what is the makeup of your membership? And in order to do that, you have to know in your own mind what a membership is. So for a very long time, our membership was how many people were signed up for our newsletter that was going out every month, how many people were hitting our website, those kinds of metrics. It's still a challenge for me to wrap my head around that. So that's something that we continue to struggle with. Because if there's one thing I've learned about sustainability planning, it's that there is no end to it ever. Okay. Next slide, please. So this is the piece where we decided, or Tom decided, that we had to take that. In the beginning of the finance project, there's a self-assessment tool, and it goes through all the different areas that you see listed here. And so we all took a stab at that, each of us individually. What fascinated me, because I just went back and looked at it, was the state office people rated all the things much lower than the coalition people, which I found absolutely fascinating. And I would highly recommend that we go back and do this again 8 years later. It would be a really fascinating thing to see where we grade ourselves now. Anyway, it took a lot of back and forth for us. We all had to come to consensus on what grade we were going to give ourselves in our progress on these different areas. So there's a lot of B minuses, or there's a lot of pluses and minuses, because sometimes we couldn't, but we could say, okay, well, we're a little better than that, so we gave it a plus, or we're not quite there, so we gave it a minus. But that was a long and arduous process for us to get through to that. So next slide, please. So again, we're looking at our vision, our desired results. We look at it every year. Are we still trying to accomplish the same things? What are the strategies that we're going to use to meet the vision, and what are the outcomes that how are we going to measure the outcomes to make sure that we're hitting the mark? And that really is the formula that we've used for the last 8 years. Next slide, please. So probably nobody better knows this than the people who are sitting on this call, but we know that there's challenges and changes every year, and it's important to identify what they are and how to strategize, how to tackle them, hence an annual sustainability planning retreat, because I don't believe, and I don't believe that anybody on our team believes, that we should ever even skip 1 year, because things change so fast. Particularly this year has been such a challenge for us all. And so every year we identify the challenges. This year they were more obvious than most, but and then we come up with our strategies to address them. And always, how do we measure it? Always. Next slide. So as Abby kind of outlined, we did retreats. We talked about we used the finance tool, funding level discussion, if we lost the funding. So I was asked before that retreat to kind of come in with an outline. What's a bare bones budget? How much would I need to maintain one staff, a newsletter, and a conference? That would be that. What would be the next level? And what we could do there. It was two. And then it was aspirational. The third level was aspirational. We have surpassed aspirational quite some time ago. And I never thought we'd get there in my wildest dreams. But I do believe that strategic planning has really helped us along the way. So if we lost lifespan respite, how much would we need to stay in business? And that's where we started. And we started at $100,000, right? That would be one staff person and the bare bones. And we worked our way forward. Looked at the big picture and kind of worked backwards. Next, please. Retreat 3, kind of putting it all together, reviewing outcomes, all the resources, all the accomplishments. We decided to do a second summit. Now the summits are in addition to the sustainability retreats. The summits bring together a diverse group of stakeholders from across the state to really look at the gaps in services and strategize how the coalition can address those services. We've also done forums, as Abby mentioned. We just did a caregiver forum where we had 4 regions, and we did a creative problem solving brainstorm process, asking the question, what might be all the ways that we can affect or change policy in the coming year? Like we put a time on it so that that we could come out with goals from this particular forum that we could take on just in a year's time, and then they could be addressed again in the next sustainability retreat. Next slide. 4, 5, and 6, strategies, building community support, which we do all the time. It's part of the formula for creating a sustainability plan. Next slide. So at every single sustainability retreat, we do a SWOT. And then, well, we did the original SWOT and then we update it each year. This year, when the coalition was faced with losing a huge grant from AmeriCorps, I did a SWOT just with the staff and brought that to the sustainability retreat because I thought 2 things. I thought it would be really helpful for the core team to see what the staff was thinking from their perspective. And I just totally lost my thought. And secondly, I'll get back to that if I can remember. Okay, so we do a logic model every year, or I should say Tom does the logic model every year. We contribute and he does this beautiful thing, which I'm going to show you. Financing strategies, we look at all our funders. What are the grant timelines? How vulnerable are we? Who are the people we can turn to for support? And of course, programs and services for caregivers. Next slide. So this is an example of our logic model. It's very small. They are available on the Arch website. I'm pretty sure they're all there. But it always looks at vision and desired results, conditions and causes, and what are those indicators? And then we move to strategies, activities, and performance measures. Next slide. Financing strategies, very much the same. What do we want to sustain? We look at what are our current programs? What are the things that we're hoping to be able to do? What would be the outcomes? The environmental scan of what's going on in our community, our state, and at the national level, and the activities and performance measures, again, around strictly financing. Next slide. So when I came on board I think 11 years ago, we had that bare bones, one staff, a newsletter, and a conference. Since then, we instituted mini grants where we work with organizations to develop or expand respite care. Most of them are drop-in respite programs. In those grants, they have to commit to serving a certain number of caregivers based on the amount of money that they're asking for. I'm not sure when this data was finalized, but we've been awarding these since 2016, 30 mini grants, $366,000, resulting in 78,000 hours of respite care. And we have more going right now. Next slide, please. Then the voucher program. As Abbey mentioned, we did a whole work group with stakeholders around the state to explore all the different models of respite voucher programs before we landed on what we were going to do. So I think I'm supposed to play this video. Is that the intention, Deana? Okay, I don't know either. I just noticed it. Okay. Can you hit that little arrow, Jill?
I probably would have to stop sharing and go back in because I didn't realize.
Oh, well, never mind. It's of me anyway, so I hate to watch it.
Well, I
So,
love
okay.
that video. If we
Okay.
have time at the end, I'll go back.
Okay. So we settled on $600 because it really, IRS income guidelines. We don't have to report to the IRS that we gave them that money at $599.99. So, because vouchers can impact people's benefits, and we wanted to be very careful about that. So it's caregiver directed. The caregiver can choose anybody they want. There really are no eligibility guidelines except that they have to be a caregiver, and we ask for someone who can vouch for that fact. So there's no income guidelines, there's no disability guidelines, it's meant to be a low barrier program to fill in the gaps where people aren't able to get respite. We do focus on kinship caregivers, informal caregivers who aren't able to receive supports and services elsewhere, and the caregivers must have a chronic condition. That is it. And the caregiver can't live in the same household and provide the respite. So since 2021, we've given out 675 vouchers, at least at last count there. I know we just did our data again, so it's more. At that time, it was $486,000 awarded, resulting in 25,000 plus hours of respite care. I just looked at the evaluation data for that program, and I think there was one caregiver who said that they did not find relief, one out of all of them, at least in this round. And they all report enhanced quality of life, which I think is just amazing. Next slide, please. So one of the pivots that we made, we decided to apply for I think it was the last round of enhancement grants, Deana. It was a 5-year grant. And because we've done sustainability planning, we had this vision in our head that we wanted to do a spokes and wheels model. Like we wanted to have different just pockets of the coalition represented around the state. So this is a pilot model. It's called the CWRC, the Caregiver Wellness and Respite Center. It's up in the way north country of the state. For those of you who don't know the state, it is mountainous and rural. They often do. I never go up there that I'm not driving around where I lose cell service. Like it doesn't exist in some parts of the state. It's very hard for caregivers to get services. There's only 1 or 2 organizations that provide in-home care services. So we knew that it would be a particularly great place to offer the voucher program. We originally started by partnering with an organization who was up there, who had the infrastructure to be able to roll this out without too much difficulty, but they came from another federal funding stream. And over the first couple of years, they had a great director, and she was doing a really good job, but she took another job and it kind of all fell apart. Like it wasn't happening. And so we decided to take the contract back and try and hire boots on the ground staff in the region. Because one of the things that we did learn was that the culture is that they're not going to talk to strangers up there. You have to be part of their, like they have to have known your parents before they're going to give you the time of day. You know, it's that kind of trust culture. So we were very fortunate to find someone who was from that region, who was moving back to the area. She's a real go-getter. She's using the CII, the Caregiver Intensity Index, which is also being used across the state in all the caregiver programs. And we have one more year left on this grant. And so we are thrilled, and hopefully in the next year we'll be able to apply for another lifespan respite grant, and we'll have learned a lot through both sustainability planning and experience to be able to roll this out further. Next slide.
I think I'm up.
I think you are.
Okay. Good afternoon, everybody. So a key component of our sustainability planning was definitely hosting 2 statewide sustainability summits. I know Doris touched on this already. These were definitely collaborative events that brought together partners, family caregivers, and we really gathered meaningful feedback and identified advocacy priorities that we feel now kind of serve as the foundation for our ongoing sustainability efforts. We do have comprehensive reports that summarize each of the summit's discussions and outcomes, and they're available if anyone's interested in a copy, if you wanted to kind of read more about the details of those 2 summits that we hosted. Next slide, please. So our journey was definitely not without its challenges. I know we just touched upon a few of them. We encountered several pivotal moments that significantly impacted our progress. Among them was being deemed ineligible for a new lifespan respite grant, the loss of some key funding streams, and some significant turnover with our core team. In addition, Doris just talked a little bit about this as well, the dissolution of the initial partnership that we had for the CWRC, and then of course the onset of COVID-19 pandemic were especially disruptive. Both, I think, logistically and emotionally. They really reshaped how we could engage with caregivers and communities. And of course, all of this occurred within a shifting funding landscape that often made long-term planning pretty difficult. However, in each of these moments, as New York tends to do, we found ways to adapt and move forward. We restructured some internal roles, we reallocated some resources, and we definitely had to strengthen our partnerships to preserve some of those essential services. We did also receive some supplemental funds for lifespan respite in 2023 and 2024, and that allowed us to provide additional respite hours and then provide some additional support with the oversight of the CWRC with that transition. And we were successful in developing a statewide respite registry, which is really a critical tool for expanding access to respite care. The heightened visibility of the caregiver needs, I would say particularly in the wake of the pandemic, really fueled some new advocacy efforts, many of which gained traction through the development of the Master Plan for Aging here in New York. But I will say, in order to ensure that we have long-term sustainability of all of these efforts, we still need to be focused on increased and more stable funding. It's essential. The additional resources would allow us to expand service delivery, strengthen our infrastructure, support workforce retention. And these are all key factors in building a resilient, coordinated system of caregiver support. So with that sustained investment, we can continue to innovate, close the service gaps, and really drive meaningful, measurable outcomes for caregivers across the state. Next slide, please. So despite the challenges we faced and the pivots along the way, we were successful in developing a written sustainability plan. This plan captures the progress that we've made, and it serves as a living document, flexible, adaptable, and it's really designed to evolve alongside the work and our future needs. Next slide, please. So now that we have a solid plan developed, next question is, how do we measure our success? Next slide. So to understand the impact of our efforts, we've put together several evaluation tools. First, we use a post-respite survey with caregivers after they've received respite services. These surveys give us direct feedback about their experience, whether they were satisfied, how helpful the service was, if they felt that their stress was reduced. And it helps us, I think, really understand the real world effect of the work from the caregiver's perspective. I know Doris just shared, she just went through those evaluations, which I think are always very telling. We also conduct follow-up surveys with respite providers after they complete training. These help us assess how well the training prepared them, whether they feel confident in their roles, and how equipped they are to support caregivers effectively. In addition to surveys, we use structured data collection forms. These forms allow us to consistently track the service delivery across programs and across regions. They help us monitor the quality, identify different patterns, and definitely show us where improvements are needed. So I would say, like, altogether, these tools really give us a fuller picture, not just about what we're doing, but how well it's working. And they help us continually improve the support that we're offering caregivers and the respite providers as well. Next slide, please. So looking ahead, we're focusing on what sustainability means in the long term. That includes planning for continued support, exploring new funding, and expanding partnerships. Next slide. I know Abbey and Doris mentioned this already in their segments, but we did recently hold 4 regional caregiver forums. Each followed a consistent agenda that was designed to balance learning, networking, and planning. These sessions were brought together a wide range of people and partners that are working to support family caregivers. They spanned systems, regions, roles, and our shared goal is to strengthen the coordination, highlight local innovations, and really begin shaping a more unified statewide approach to caregiver support. So the attendees included staff from New York's 59 area agencies on aging. Yes, 59. It always surprises people. Caregiver program staff, New York Connects staff, some staff from our independent living centers, NYSERC's membership. We had partners from the Aging Network, like other community-based organizations. And then we also invited, which I think was a great membership to invite, was the members of the Master Plan for Aging's Informal Caregiver Subcommittee. So in short, really anyone actively working to improve the lives of caregivers across the state were invited to these forums. So each of the forums began with a national perspective. While we had initially invited Greg Link from the Administration for Community Living to present on the national strategy to support family caregivers, NASHB graciously stepped in and covered this segment for us, and it really grounded our state efforts in the more broader national conversation. So we followed that presentation on the national strategy with a panel of state agencies featuring representatives from our agency, the New York State Office for Aging, the Office of Persons with Developmental Disabilities, the Office of Children and Family Services, the Office of Mental Health, the Department of Health, and then we had a few others. Each of these agencies did provide a brief video presentation under 10 minutes outlining their current caregiver supports, how they align with the national strategy, and any areas for growth. So these videos are available. If anyone's interested, you can send us a request. We're happy to share them. Then participants also received an update on the Master Plan for Aging with a focus on how caregiver support is being integrated into long-term state planning. And just on a side note with that, our final plan was just publicly released on June 30th. I did see something go out from Arch, but definitely check that out if you haven't already. I'm working my way through it myself. Then we did have a networking lunch at the forums that gave the attendees some valuable time to connect and share, some experiences and maybe explore some potential collaborations with each other. In the afternoon of the forums, we did transition into a solution-focused session that was led by Dr. Teresa Lawrence. This interactive workshop encouraged participants to generate ideas that will help shape NYSERC's 2026 legislative priorities. And then we closed each of the forums by outlining next steps and how we plan to keep everyone informed and engaged moving forward. So in short, these forums represent, I think, a significant step toward a more coordinated, informed, and responsive caregiver support system in New York. And we really hope that it will inspire stronger partnerships and advocacy in the months and years ahead. Next slide, please. So at our 7th retreat, we focused on, as Doris mentioned, which we always do at each of the retreats, refining our logic models and revisiting the SWOT analysis. So we took a close look at what still needs to be accomplished during our final year, especially when it comes to advocacy. And we began exploring ideas for future funding, including the possibility of a new regional center. We didn't include a slide for this because, as we were just talking about, we did just hold an 8th retreat that happened last month in June. So our slide deck was already approved, but I still wanted to kind of talk about it and just walk you through what we did during that retreat last month. So again, we reviewed and updated both our sustainability and our financing strategies logic model. On the financing side, we emphasized the need to prioritize core operations and ensure that our performance measures align with funder expectations. And we did do a deeper dive into the funding landscape. We kind of wanted to separate and see, like, what are the critical needs, what are kind of the nice to have enhancements, and then we kind of had some outliers. So we identified critical needs as definitely staffing for NYSERC, program implementation, partnerships, of course, respite services, training, and data systems and evaluation. For the nice to have enhancements, which I think will be really important if we do get another funding opportunity, we identified technology improvements, expanded outreach and marketing, and stronger connections with local caregiver coalitions and legislative partners. So we did flag some other ideas that are kind of considered out of scope right now, but they were private sector partnerships and hospital-based programs. As part of the sustainability planning, we revisited our business plan and stakeholder needs. So we did update our SWOT analysis, and what that revealed is that there are some weaknesses such as limited caregiver voice and underperforming advisory group. So we talked about opportunities to expand mini grants, collaborate with AARP, and improve marketing. And then we also reclassified team communication from a strength to a weakness. And as a result of all of these findings from last month, and we're still digesting, because I think one thing that we all think about when we know it's important work, but when we leave there, it is mentally exhausting. So I feel like we're all still processing. But as a result of last month's retreat, we are revamping some things, in particular, the advisory group, with a sharper focus on advocacy and turning that into looking at short-term task force that'll be focused more on specific goals. We thought that that would be a better approach, since that's been a struggle for the coalition for some time. And we're also intending to recruit some new members for these task force missions from our interest list that we got from these caregiver forums that we held in the spring, because we did solicit interest from the attendees. And so the idea moving forward is we are going to be asking these interested parties to complete a survey so that we can kind of assess the skills and the commitment. And then on the advocacy front, we're aligning with New York's master plan for aging, and we'll be shaping our messaging using like a mix of data and caregiver stories, particularly as we prepare for the legislative budget cycle, because those submissions are going to be due by late February. And it's really critical that we are clearly communicating the risks of unstable funding and the essential statewide role that NYSERC plays, especially in ensuring access to respite. Looking ahead, those strategic priorities remain focused on sustaining NYSERC's core operations, including respite offerings like the vouchers and the registry and training and mini grants, and advancing those advocacy efforts aligned with both the master plan for aging and the national strategy. And then strengthening those partnerships with health systems, higher education institutions, and then diverse caregiver communities. Next slide, please. So that brings us to a close. That covers all of our key takeaways. We'd love to open the floor for comments, thoughts, and questions. But before we do that, the next slide, which is our last slide, has all of our contact information if you'd like to follow up with us. And we are always happy to continue the conversation and collaboration with you. Thank you.
Thank you, Deana. That was wonderful. And I kind of walked with these folks during our sustainability learning collaborative over the years, but we haven't been meeting for about a year. So I'm actually kind of blown away, but when I see it all in one piece, just astonishingly good work. So let's unmute yourself if you have questions, comments. I've got a whole ton of questions myself, so. So I'm just going to jump in and see if we can get anybody else. So I'm really interested in how many sustainability planning groups that you've done over the years. And I'm wondering about the attendance and enthusiasm. And I'm also wondering if they've become easier over the years.
Who wants to take that? We've done 8,
Is it
as
the
Deana
retreat?
said.
Yeah, I wanted to clarify, Susan, you're talking about the retreats, right?
Yes.
They've
I think
grown
yeah, the retreats.
Yes, they have.
because NYSERC staff has grown, which is wonderful.
NYSERC staff has grown, and we include more of the staff than we used to in the beginning. And are they easier? That's a hard question. I think it depends on the year. I think I was most exhausted the first year because it was just mind-boggling to me what the scope was. But Tom's done a great job at breaking that out and keeping it going. So it's always interesting.
Mm-hmm.
You know, and they're pretty much they're a day-long retreat. Like they're 6 hours.
Yeah, and I think we were probably in the early years split half and half with about 5 to 6 people, right? It was like 2 or 3 from the state and 2 or 3 from NYSERC. And then now I think the last one we had, did we have 10? It's almost doubled,
yeah,
right?
Yeah.
Yeah, and it's doubled on both sides because now we have like Abbey joined the team in the second year of the retreats. And then we had, now we have a data person, Caitlin. We have our No Wrong Door representative from New York Connects. That's all from NYSOFA's side. And then Doris has her team. So
yeah. The more people, the richer the discussion.
Mm-hmm. Yeah. I mean, related to that, your discussion about the sustainability, the yearly retreats, the summits, and the caregiver forums was just fascinating. But Deana, I think you used the word coordinated, and I had written that down when I was listening to you, like the coordination across levels and the broad representation is just, it's really excellent. So what are the fruits of that? What are you getting out of that, the cross-level planning and the broad inclusion? What do you think the benefits of that have been?
Who can out delegate each other?
I will say I didn't include this in the slide or in my talking points, but I do have to admit that we had to do some pivoting within the forums too. What Abbey and I had envisioned for the piece related to the national strategy and trying to have our state partners speak to what they currently have to offer family caregivers within their network and like where they may have identified like goals of the national strategy that they could start to think about, right, different things that they could do to meet those goals. they kind of missed the mark a little. We appreciate what they shared. Their videos are great, but there was not that connection. So after the second forum and getting feedback from the attendees, we kind of put our heads together and we were like, we'll happily share the videos. I think it was difficult. People don't like to just sit through videos, but we understood our state partners couldn't go to each of the 5 locations, a lot of travel. So you kind of lose that in-person, engagement. But I also feel like it's not as much of their world as it is ours. So we had to help build that. So Abbey went back and she did a phenomenal job in basically taking resources and things within their videos and their fact sheets that they provided. And then she put slides together that tied it to the goals of the national strategy. And it was like night and day. Like people really got the feedback we got was much more positive. But I also think a light bulb went off and they could see what we were trying to show them and make that connection. So it's unfortunate that the first 2 didn't get that same experience, but you have to pivot sometimes when something's not working. And that's what we do that pretty well.
Ah. Well, one of the things that you shared that really stood out to me was how you kind of graded yourself. And that had to involve a lot of deep conversations, right? But the thing that really impressed me is that's real leadership responsibility and accountability and fearlessness and saying, and I've known this from working with all of you, yeah, this didn't work the way we thought it would. And the pivoting, how can we, tweak this so that it works better for everybody? I'm just looking in the chat box. If you don't feel brave to unmute and ask questions, feel free to put questions in the chat box. Any burning questions from folks? Any nice compliments you want to share with this group who actually pulled this off?
Hi, Rita from Arizona. Hi, Deana and Doris. I always love what New York does. We do, borrow a lot of their work. So thank you for that. But I was just wondering, in terms of family caregiver response, in the marketing or outreach, did caregivers respond to caregivers, or did you find that there's more engagement when, there's different terms used, or maybe tasks or services rather than are you a caregiver?
I can speak for NYSOFA. So we developed a caregiver's guide video that highlights exactly what you said, Lita. It kind of takes away the word caregiver, but frames it more like, are you doing X, Y, and Z for somebody? If you are, then you are a caregiver and their services available to support you. So I think that's been really beneficial for us, and it's available on our website. I think some of our AAAs even use it as well. I don't know, Doris, if you have anything to add from the NYSERC marketing perspective.
Well, I can just say that it's an ongoing conversation. The term caregiver and caregiver self-identification, it was even a huge conversation in the master plan when we were talking about the best way to reach caregivers. I don't think there's a simple answer to that because people identify in so many different ways, So I don't think there's a simple answer, but I think, as Abbey said, at least helping them to identify if you are doing these tasks, then you have options for assistance.
Mm-hmm.
Thank you, that's helpful. And I do see the link for the video. Thank you for that as well.
No problem.
And we'll have to keep you all posted, but I did want to mention that if you are able to check out our final master plan for aging, there are 2 proposals in there. One that is to establish a caregiving commission, right? I keep messing it up. I know it's commission.
It's a caregiver commission. I believe it's anyway.
Caregiver. Yeah. Okay. So we had proposed a commission. So there is the proposal is in there that kind of outlines what that would look like, governor appointed. And then we also have another proposal in there for the coalition to be funded. And recognized in state statute. So we're excited that those both did make it to the final NPA. So we're fingers crossed. We're hoping that that will really help with our sustainability. And that's the reason I'm raising it. So we'll continue to keep everybody posted.
Yeah, and the funding piece through the state is, it's been a long time coming because I stole that idea from Alabama. So thank you, Alabama. It's also the #1 legislative priority for the coalition in the coming year, and Lifespan, who is the agency that houses the coalition, is adding it as a legislative priority for in the aging. So we have some momentum finally, and it's very exciting.
That's fantastic.
And from the forums, we had like 18 people reach out and say they wanted to participate. We have a meeting with them next week. So,
Wow, that's great.
yeah.
Any last questions or words of praise?
Wonderful work. You guys always do an amazing job. I had a question about your evaluator. How you engaged your evaluator long term? Were they part of your funding for which program? Who supported the evaluator?
The coalition supports the evaluator through Lifespan Respite funding, and I believe has been on since year 1, which is way before Deana and I ever came on the scene. So he knew it better than we did when we, came on.
And I think he was a partner of Lifespan's, right?
He's
Doris,
been
in other initiatives. And that was why I think that's where the relationship grew from, if that helps, Cheryl.
He was well known to Lifespan.
Yeah.
I mean, he's deeply knowledgeable and caring about respite itself. So he wasn't phoning it in, right? I mean,
Yeah, he's got a very long resume and a lot of letters after his name, but he's now the chief of gerontology at U of R Medicine.
And Jill just wrote in the chat box that he's serves on the Arch Committee for the Advancement of Respite Research.
Yes.
He's definitely committed, because there's no way, you know what I mean? He doesn't do it for the money. I'm sure there's a passion there. He's committed,
Yeah,
for sure. For sure. And if you want to make your evaluator happy, make sure you have different colored markers, because without different colored markers, he's rendered powerless.
As you can
make
see
sure he
from
works
all the
with
postings.
Yeah, make sure he works with a team like you that are equally committed. I remember Deana talking like after the first or second one of these, and we just had a kind of private conversation where you said, well, this is never going to be done. It's a living document. And I think that's really key. These folks are staying on, enjoying the ride wherever it takes them.
For sure.
So with that, I send you all off to have a good summer. Enormous thanks to our colleagues in New York for their generosity in sharing with the network. And remember, they do have this collective wisdom. So if you have a question, you know how to get hold of them, call them and ask them. That's how we all grow stronger.
Please make note that we have our final webinar in this series on July 31st. And we'll be having Tracy Sinowitz from the Alabama Lifespan Respite Network presenting. And given that they've been around since 2000, they have an enormous amount of expertise on sustainability to share. So please join us for that. And I also want to thank the New York team for just incredible work. I'm very excited about the recommendations you had included into the master plan on aging, and I wish you very much luck with all of that. It's tremendous accomplishment.
Thanks, Jill.
Thank you. Our pleasure. Anytime. It was great seeing everybody.
Thanks.
Thank you, everyone.